Thanks for the opportunity. Introduce me, my name is Isti Anindya. I come from Indonesia. I would like to present my presentations about the research that I have done with my colleagues Mrs. Nur Eni Lestari, and we are lecturer at STIKes Indonesia, Maju, Jakarta, Indonesia. We have finished a study with the title Future Anxiety Among Parents of Children with Autism Spectrum Disorder during COVID-19 pandemics in Indonesia. For the outline, we have introductions, method, result, discussion, conclusions, acknowledgement, and reference. COVID-19 is likely to have increased distress for children with autism spectrum disorder and their families. This condition will have broken the daily routines of children with autism, like social isolations and social distancing. During the pandemic, access to therapy and education for children with ASD was stopping because it was difficult for them to follow protocols for COVID-19. This situation certainly has an impact on their milestone development and also impact for parental anxiety level. Autism spectrum disorder or ASD is a neurological and developmental disorder that begins early in childhood and lasts along a person's life. It affects how a person acts and interacts with others, communicates and learns. ASD in children during pandemic could trigger mental health problems in parents. Parents of children with ASD are at risk for higher stress levels than parents of children with other developmental disabilities and typical development. Disclaimer, I am the mother of an autistic child who has had much difficulty dealing with my child during the pandemic, so it relates between my research and my real life. A study in 214 states that out of 243 mothers with disability children found 65% of parents with ASD children experience psychological disorder, 48% depressive disorder, 41% anxiety disorder, and 85% stress disorder. Meanwhile, for parents with other types of disability, only 35% of total respondents. If future anxiety in the mother is happening continuously, it will significantly impact the progress of the child development. So, in this study, we try to find out how the future anxiety condition of parents of autistic children during the COVID pandemic are. Are they getting worse? Next, we talk about method. The study used a cross-sectional approach with an online observational study. A sample of participants with ASD was recruited from Peduli ASD community in Indonesia. They are parents of children with ASD who registered as a member. The study sample was 89 respondents. Participant recruitment in September 2020. With an online survey method was using the Google form from collecting data. The evaluation instruments were self-informed questionnaires that measure psychological status found in parents. We use future anxiety scale 1 and measure the risk of ASD in children with the modified checklist for autism in toddler or MCHR. We use the Spearman rank test for statistical analysis on the results of the questionnaires for the analysis in differences in variables. Ethical approval was obtained from Sekolah Tinggi Ilmu Kesehatan Indonesia Maju. This study involved 89 participants, parents of ASD children. The main age of the responder was 32 years. There is no correlation between parental age. There was a significant relationship between family structure, parents' education, employment status, and annual family income, with p-value 0 for all correlation. The majority of participants in the study were mothers of 56 participants who had high future anxiety scores. We could see most of the responders are female, which means a mother. Moreover, most children have two parents, a mother and a father. And for parents' education, mainly in college. For employment status, most of them employees with annual family income more than minimum wage. And for the correlation between parents' sociodemographic and future anxiety score, p-value 0, there was a significant correlation. This study also found a correlation between ASD level, we measure with MCHAT, in children and future anxiety level in parents with a p-value 0. The level of the correlation coefficients in 0.626, meaning that the correlation between ASD level in children and future anxiety level in parents has a high correlation. Based on statistical analysis in this study, future parental anxiety is closely related to the risk level of ASD in children. Their child level of ASD generally influenced the anxiety of the parents of ASD children. The groups of parents with high ASD level, 49 participants, had high scores for the future anxiety scale. Overall, from 89 participants, it was found that 65 participants, 73%, had a high score on the future anxiety scale. Parents of children with ASD face numerous potential challenges and daily stressors associated with parenting a child with ASD, including child behavior problems. Consistent with previous literature, child problem behavior significantly contribute to parenting-related stress and psychological distress in mothers of children with ASD. Many factors generally cause future anxiety found in parents with ASD children. One of the main factors is the caregiver's burden and condition of ASD children. The burden of caregivers is very closely related to the level of stress and anxiety during the pandemic. The future anxiety experienced by parents could be overcoming supporting them to take psychological treatment medically. Social support for parents with ASD children needs to be widely applied in various countries, especially in Indonesia. Practical guidelines require parents to help them with autistic child care and stress management during pandemic COVID-19. Parents with ASD children have to adapt well in a pandemic situation, considering that this condition will last for quite a long time. Several studies related to COVID-19 and ASD also reminds parents that parent stress and psychological disorder will increase if they are not managing appropriately. Research is expected to be a source for parents to obtain information related to future anxiety condition that can increase children's risk of developmental disorder. Parents should be able to maintain the quality of life for themselves and their families. Good quality of life to be one of the keys to the success of caring for ASD children. And for this conclusion, this research was finding of a high correlation between the two variables. Future anxiety is one condition that parents of children with ASD cannot avoid. And parents' age, parents' gender, family structure, parents' education, employment status, and annual family income are directly related to an increased future anxiety level in parents. The author are pleased to acknowledge Peduli ISD, who provides respondents, and STIKes Indonesia Maju, who provide funds for this research, and ITTP COVID-19, who allowed the author to present the results of this research. Thank you for your attention. I will be happy if you all want to discuss this research with me. Thank you.